When I thought about MBBS abroad, I was just focused on one thing: getting into the university. That's it. That's the dream, right? But no one talked about what comes after you finish your MBBS abroad. And honestly, I get it. When you're just starting, you don't think that far ahead. But now, after seeing seniors, friends, and batchmates, I'm telling you, the real struggle starts after graduating. So in this video, I'll talk about what are your options after MBBS abroad and how not to get stuck after graduation. Welcome back. My name is Ayush. I'm a medical student at Kazakhstan State Medical University, Russia. In this video, we will be talking about what career options you have after completing your MBBS abroad. Every year, around 35 to 40,000 Indian students move abroad for their medical education, but only 20 to 25% of them pass the FMG exam, and around 3 to 5% go to US or UK and settle abroad. Around 10 to 15% of the students practice in low-barrier countries such as Nepal, Maldives or the UAE. Around 25 to 30% switch their careers outside of medicine such as teaching, pharmaceuticals and even do business. And last, around 10 to 15% of the FMGs switch to non-clinical roles such as medical writing, research, healthcare management, etc. So realistically, only 40 to 50% of FMG continue in clinical medicine, while a big chunk, 30 to 40% of FMGs either completely leave medicine or settle into non-clinical roles. So before I explain the options, you need to ask yourself a question. Where do you want to practice? India, abroad or non-clinical? What kind of lifestyle you want? What kind of work-life balance you want? After you have answered yourself these questions, let's start with the most common path. Coming back home, coming to India. If you want to become a registered doctor or do your masters in India, your path is very different from someone who wants to move abroad or someone who wants to get into medical research. For being a registered doctor in India, you must appear for FMG, that is Foreign Medical Graduate Examination. It will be soon replaced by NEXT, which will not just be a screening exam, it will also count for a PG eligibility. You will have to do a mandatory 1 year of internship when you return back to India to become a registered doctor. Second option, settling abroad. And honestly, I have seen people succeed or even fail because they didn't plan this very early. Let's start with the first option. If you want to go to the UK, you have to appear for two examinations, that is PLAB 1 and PLAB 2. After you clear this examination, you have to register yourself with the GMC. After registering with the GMC, you can work as a doctor and later apply for a PG. The second path will be choosing the USMLE or the US step. For USMLE, you have 4 steps to clear, the first one being step 1. The second is step 2 seek, that is clinical knowledge. The third step is match, that is matching into your university or your hospital. The fourth one being step 3. This route is very expensive but leads to the highest salary and better opportunities. If you're targeting to settle in countries like France, Germany or Japan, you must learn B2 level German, French or Japanese. Then clear the approbation examination to become a registered doctor in the respective country. The pros are the PG is relatively very cheap or free of cost. The work-life balance is great and you'll have a good lifestyle. But what if you want to stay in the country you did your MBBS from, be it Russia, Kazakhstan or Georgia? You can do PG locally, but practicing outside the country is very difficult, as they don't offer global recognition for the PG program and most of it is in their local language. So be very careful with this choice. Option 3, the non-clinical route. There is a third part that many don't talk about, non-clinical medical careers, and this is becoming very popular after MBBS abroad. You can pursue Masters in Public Health, which is very popular in the West. You can go for management, that is MBA in Hospital Management, which is highly demanding. You can get into clinical research programs in a hospital or a pharmaceutical company. You can get into medical writing, healthcare IT, medical coding, some even switch to data science in healthcare. The pros are less stress, work-life balance, a very good salary, and the con, according to me, is that you won't be directly helping a patient or directly treating a patient, so it will be less fulfilling. A very genuine question is how to decide what is right for you. By the end of your second or third year, you must speak to your seniors, research the licensing exams or the pathway, be it USMLE, PLAB or NEXT. Be honest about your financial situation, as USMLE is very expensive, PLAB is moderately expensive, and NEXT is affordable. Consider your long-term goals, the specialty or the job profile you want to enter in, the country you want to live in, what are your salary expectations, what kind of work-life balance you want, what kind of lifestyle you want, etc. Remember, MBBS abroad doesn't lock you in a specific path. There are multiple exits, but choose your lane before it's too late. So this was it for this video. If this video helped you a bit, please drop a like. If you want me to make specific videos on each pathway, please drop it down in the comment section. Please subscribe to the channel as it will help me grow the channel more. Thank you so much for watching until the end. See you soon. Jai Hind.